Good day. Thank you for joining us for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabert Schuster, State Director for AARP in this territory. We're here today to celebrate a big victory and discuss the historic provisions for lowering drug prices for Medicare recipients in the Inflation Reduction Act of 2022. This monumental victory would not have been possible without the continued support and grassroots actions from AARP's nearly 38 million members across the country. We are here today to celebrate, give thanks, and learn more about how these new provisions affect AARP members like you. I'm proud to share that after decades of calling on Congress to make prescription drugs more affordable, we won the fight for Medicare to negotiate lower drug prices and help save people money on their medications. Thanks to all of the AARP members for sending countless emails, making countless calls, and sending more than 4.3 million petition signatures to Congress. Millions of seniors will get relief from out of control, prescription drug prices. Congresswoman Stacey E. Plaskett represents the United States Virgin Islands at large congressional district in the United States House of Representatives. She is currently serving her fourth term in Congress. For the 117th Congress, the members of the House Steering and Policy Committee unanimously appointed Congresswoman Plaskett to serve on the House Committee on Ways and Means, the oldest and one of the most exclusive committees in Congress. In true historic fashion, Ms. Plaskett is the first member from a U.S. territory and the fourth African American woman to serve on this committee. She's currently serving her fourth term on the House Committee on Agriculture and is the chair of the Subcommittee on Biotechnology, Horticulture, and Research. Ms. Plaskett is also a new member of the House Committee on Budget. Previously, Congresswoman Plaskett served on the House Transportation and Infrastructure Committee, as well as the House Committee on Oversight and Reform. Ms. Plaskett is a member of the Congressional Black Caucus, House Blockchain Caucus, and the New Democrat Coalition, where she is a co-chair of the Infrastructure Task Force and the at-large leadership member. Congresswoman Plaskett also co-chairs the Congressional Caribbean Caucus. During her time as member of the Committee on Transportation and Infrastructure, Ms. Plaskett advocated for improvements to critical infrastructure in the U.S. Virgin Islands and the insular areas, as well as the development of economically depressed rural and urban areas. As a former attorney in public finance law, Congresswoman Plaskett sees the importance of public-private partnership and worked to create constructive, innovative mechanisms for incentivizing economic development in underserved areas in America. During her service on the House Transportation and Infrastructure Committee, Ms. Plaskett worked to ensure that the federal government is responsive to the needs of Americans in disaster-stricken areas. I am now pleased to welcome Congresswoman Stacey E. Plaskett, Delegate to Congress for the United States Virgin Islands. Thank you for joining us today for this important conversation and to learn more about the Inflation Reduction Act of 2022, which includes a historic win for America's seniors. This is your chance to hear from Congresswoman Stacey Plaskett and the efforts that led to this historic win. Good day, Congresswoman Plaskett. Welcome.
Thank you. Thanks so much. And good day to you and to, of course, all of the members of AARP who are here with us.
Thank you. It's always a pleasure to have you on the program, and I must especially thank you for always being responsive to the call of AARP, not only AARP in the Virgin Islands, but AARP National. Every time we've called on you, you've always been there to listen to us, to the needs of the older population, and always advocating for those needs in Congress. So again, thanks so much for all you do.
Troy, you are masterful in corralling some of the strongest seniors in our community, and you don't have any choice but to respond when they come after you about an AARP matter. And of course, all of us know that at some point or another, we really want a strong AARP because we want to be a member ourselves.
Exactly. Thank you so much for saying that. And it's a pleasure and it's a great honor for me as a Virgin Islander myself to work for this great organization and to advocate for the needs of the older population right here in this territory. And I thank you and also especially our Governor, Albert Bryan, for always being so very responsive. And so we're here now today talking about this great win. And so, as I mentioned earlier, AARP successfully advocated for provisions in this historic Inflation Reduction Act of 2022 designed to improve, reduce the cost of prescription drugs and lower out-of-pocket costs to millions of older Americans. This included allowing Medicare to negotiate the prices of prescription drugs and expanding access to low-income subsidies by expanding the income threshold for eligibility and other provisions that support Americans during these challenging times. Please share with us, what role did you play in ensuring Virgin Islanders receive the full extent of the Reduction Act?
Well, when citizens elect members to Congress, it's to participate in debate, advocate for their needs, contribute to congressional committees, and vote when appropriate. As the delegate to the Virgin Islands, I presently do not have the full vote on final passage on the floor, vote in committee, and do all of those other things. Therefore, it's especially important for me to use the other areas to advance the needs of the Virgin Islanders, to try and outsize of ourselves in those areas. One of those, as I said, was contribute to congressional committees. And leveraging my position on the House Ways and Means Committee, which is the congressional panel with purview over national Social Security, including the Social Security program and Medicare program, allows me and my staff the opportunity to really be engaged. Through my committee activity, I'm provided unique access in decision-making process, which allows me to advocate for our senior citizens and AARP members throughout the Virgin Islands. And that was especially true when we looked at the Inflation Reduction Act. So by leveraging those connections, using my voice, as well as my vote in committee, I was able to directly advocate for Virgin Islanders and our senior citizens to ensure that they were treated as fairly and equitably as possible in the Inflation Reduction Act. And as a result, we were able to lower prescription drug prices by enabling Medicare to negotiate the price of prescription drugs, which prevents excessive price hikes, the caps of out-of-pocket costs to $2,000. We've also been able to lower the cost of healthcare by capping insulin, which unfortunately in the Virgin Islands, a disproportionate number of Virgin Islanders being diabetic do use insulin, and we are capping it at $35 a month for Medicare beneficiaries. Those are some of the work. So the primary leverage was my position on Ways and Means, and also working hard to promote more visibility for the Virgin Islands and U.S. territories. So when Congress debates national issues, as an active and a really strong member of the National Democratic Party, a voice on a national news platform, being able to show up, it also projects the Virgin Islands and makes sure that we're included.
Wonderful. I have been a pharmacy owner for many years. I don't run the pharmacy anymore. My sister does that now, the medicine shop in Sunny Isle Shopping Center, but I still help out behind the scenes. And as you mentioned, insulin is one of the top sellers and all of the anti-diabetic medications. But we sold a lot of insulin. And every day people would come in and they would be totally angry with the pharmacy, thinking that we're the ones who set these high prices on insulin. But truth be told, at least here in the Virgin Islands, all of the pharmacies, we all have a pact that we don't make very much profit off of insulin at all historically. We just really provide it as a community service. What we sell it for just covers the costs of
Mhm.
obtaining it and shipping it in. But it's historically the drug manufacturing companies and then through the distribution companies that had the cost of insulin that high. So now, with this new law, as you mentioned, allowing Medicare to negotiate the cost to help to bring the costs down, it takes away some of the power of big pharma and puts some of that power in the hands of Medicare. And so then we can see a reduction in the cost of insulin. And again, at least here in the Virgin Islands, I can't speak to the rest of the country, but here in the Virgin Islands, I know that the pharmacies will pass those savings on to the consumers. So this is something that's really, really exciting because, again, historically, the cost of insulin is so high, especially those pre-filled syringes where you just dial in and inject yourself easily, but all of the costs of insulin very, very high. And so going back now, you mentioned that in your role in Congress that you're not able to vote. So this makes it extra hard for you. Tell us a little bit about that and how you have to lobby your colleagues to get
Sure.
them to vote in favor of certain
So,
things.
so let's just first correct that we have a limited vote. So
Okay,
it's not that we don't vote at all.
I got it.
And that's a misnomer. So
Got it.
members of the territories vote in committee. When the Democratic caucus is in control of the floor, members of the territory also vote on measures except for final passage. So we vote on amendments, vote on other procedural votes. It's just final passage that we don't vote on. But because we don't have that final vote, which is, of course, so very important, we have to many of us try to make up for it in other ways. The way that I've chosen to make up for that is showing up, right? Volunteering for things, really being present, being on the floor for final passage, even when we don't vote, to be able to lobby and advocate and talk to other members of Congress who are there. Also making sure that our staff, which my team is absolutely phenomenal, are looking at pieces of legislation that are moving on the floor and seeing where there are ways for us to be able to put in components of it for the Virgin Islands, or making sure that legislation that's being drafted includes the Virgin Islands. I think when I first got here, many members were often would write legislation and say the 50 states and the District of Columbia. I think now many of them know to put the 50 states, the District of Columbia, and the territories in
Mhm.
legislation, because so often we would just be left out of components just because people did not see us, did not hear from us. So making sure that our voice is heard, being on very influential committees. So being on Ways and Means, that's a very exclusive committee. Not many people are there, but all of the revenue generating legislation that comes out of Congress comes through Ways and Means. So there are many members who need legislation, need language put in on Ways and Means bills, and they will come to members of the Ways and Means Committee to ask us to support or to advocate for them. And that also gives us kind of a bartering leveraging to be able to
Uh,
do with people by saying, okay, when we go into committee, I'm going to make sure that this is included for you. I'm going to vote on this for you in committee. And then I can turn around a month later or however and say, listen, I really need your support on final passage on this piece of legislation. I really need you in your committee to support the Virgin Islands, to support the territories and other pieces of legislation.
Great, and thanks so much for clarifying that for me and for our listening audience that you do have a vote in committees. I was totally ignorant to that, ashamed to
Mhm,
say,
mhm.
for pretty much all of my life until today. I thought that our Congress person did not have a vote at all, but so you do have a vote in committees, but not in the general and the full body. But again, you can use that and leverage that
Mhm.
to your benefit, especially in the House Ways and Means Committee. So, could you tell us the provisions within the Inflation Reduction Act of 2022 that directly affect America's 50 plus population? For example, allowing, again, Medicare to negotiate the insulin cap, penalizing drug companies if the prices higher than inflation, etc. Can you go into a
Sure.
little more detail on those provisions?
Sure. The improvements to Medicare are really very tremendous achievements for senior citizens and for all Americans. So prior to the Inflation Reduction Act, more than 5 million people with Medicare struggled to afford prescription drugs. And as the premier federal health insurance program, that was absolutely unacceptable. Now, by working with private medication manufacturers and negotiating better prices, we're able to lower high prescription drug costs for seniors. So the Inflation Reduction Act empowers the Secretary of Health and Human Services to negotiate the price of prescription drugs covered under Medicare for the first time. And this applies to Part B, which is medicines provided in doctors' offices or other outpatient settings, and to Medicare Part D, which provides for retail prescription drug coverage for Medicare beneficiaries. There is a Part D prescription drug plan offered by United Healthcare that's available to Medicare beneficiaries in the Virgin Islands. And this is something that Republicans fought for many years, but now it's finally happening. 90% of Americans wanted to see negotiation of prescription drugs, so this is very popular among people of all persuasions. So we'll start off with 10 drugs that are negotiated in 2026 and then ramp up to 20 drugs a few years after that. You know, we've got to look and see when the negotiated price ends before you begin new contracts. This will be for single source drugs that do not have competition. And these are the ones that are going to be negotiated by the secretary. The secretary also can demand a negotiated price that is no higher than the non-federal average manufacturing price, which is a price that other partners in the federal government, like the military, the VA, et cetera, use. It will be a percentage of that, depending on how long the drug has been on the market. The drugs that are negotiated are generally the most expensive drugs in Medicare that do not have competition. And then another key component is that for the first time ever for Medicare Part D drugs, those purchased at the pharmacy counter, those costs will be capped at $2,000 per year. So right now, there's no cap on the cost of prescription drugs and Medicare Part D. It can go on and on, escalating. Copay reduced at over $7,000 this year to 5%, but there's no cap. So seniors can continue to pay very high prices for expensive drugs like those that help to treat cancer. There's a decent amount of people who reach the catastrophic threshold of $7,000 for their first fill in a year. So this is going to be meaningful for people who are facing very high drug prices. There's a cap that goes into effect in 2024, but it's going to be at around the 7,000 threshold. The true 2,000 cap will go into effect in 2025. The act also allows beneficiaries, if they hit that cap on the first bill, to spread those copays out throughout the year. There's also an inflation rebate that says that no drug manufacturers, if you raise their Medicare drug price faster than inflation, you're going to owe Medicare a rebate for the difference. Social Security checks don't increase higher than inflation, so neither should drug prices. This is similar to a rebate under Medicaid. This pulls that over to Medicare as well. And the inflation rebates under Medicare Part B and Part D are incredibly impactful, regardless of whether it only applies to the Medicare program. While this is only those units that will be subject to the inflation rebate, the price will be implicated in the rebate. It's market-wide. Another thing to flag for Medicare Part Medicare Part D, is that through 2030, there will be a 6% cap on premium increases. This is because we're making a lot of changes and to make sure that beneficiaries don't feel any big changes as the marketplace tries to adjust and figure everything out. And of course, as you've stated, the $35 cap per month on insulin prices for Medicare beneficiaries. There will be $0 copayments for vaccines and Medicare, Medicaid, and CHIP. So the provisions on prescription drug costs look very similar to what the House passed during the president's Build Back Better bill. And members of Congress worked really hard over a long period of time behind the scenes so that the Medicare program can negotiate drug costs. This is a big win for the country. And a lot of stakeholders, especially including AARP, have been hard at work at this for many years. And so we're grateful to the support that AARP, that you, Troy, and your team and the team in Washington have done to support this. And we're grateful and excited that it's finally become law.
That's fantastic news. That's a lot of great improvements for our older population with regard to the cost of drugs. And so, do you think helped convince the senators to vote
Mhm.
yes to support lowering the costs of prescription drugs and passing the Inflation Reduction Act after that long fight? Is there any one
Right.
thing that
Well,
you can point to
I
that
think
really
the
pushed it
reality
over?
is, yeah, I think the reality is that many Americans are struggling to afford their prescription drugs. And with the added pressure of inflation and times being really hard, uh, everyone agreed that something needed to be done. And while it took over a year to negotiate and even longer campaigning on the issues to come up with a plan that enough people could agree on, that not only would it pass in the House with the simple majority that we use there, but also that it would pass in the Senate. In the end, the Democratic majority in Congress was able to unanimously send President Biden a bill aimed at tackling climate, tax fairness, in particular, the cost of prescription drugs for seniors. So the Inflation Reduction Act contains an important set of investments, and the bill will put the United States on a path to reduce not just the things that we're talking about here, but carbon pollution by 40%, investing in renewable energy, accelerating gradual transition from fossil fuel, as well as the support for our seniors. So, long time coming, but I think the confluence of times being hard, inflation, and the other components that needed to be done is what brought it over the line.
Fantastic. And AARP is the largest lobbying organization across all 50 states, Washington, D.C., Puerto Rico, and the Virgin Islands, advocating on issues that impact the lives of persons 50 years and older. What priorities on the federal level do you envision pursuing that would create a more livable territory, in particular, for our residents? And how can the advocacy work of AARP in the Virgin Islands align with your efforts on the federal level?
Sure. So, right now, to build a better, more equitable future for residents across the Virgin Islands and other territories, we've got to focus on developing our infrastructure, delivering quality education, funding our hospital, medical facilities, as well as strengthening our public safety programs. And we all know who are watching this, those of us Virgin Islanders, that when Hurricanes Irma and Maria came through in 2017, they left a wake of destruction, and that we're trying to repair the islands to this day. And although I'm thankful that the federal funding has been allocated to make the repairs and replace critical infrastructure, hundreds of millions of additional dollars have been secured for the Virgin Islands to provide healthcare to our people on the Medicaid program. More needs to be done still to create an equal living environment for all Virgin Islanders. So much of my time in Congress is working on economic development measures that will help us grow our economy, to diversify the economy, to support having a professional and skilled working class of individuals. And that's not all. We're also working on rebuilding the critical infrastructure, making sure that the money that was allocated is actually obligated and drawn down, such as completion of Myra Keating Smith Health Center on St. John, Juan F. Louis Hospital, which I know you are so passionate about. And I've repeatedly called for additional Medicaid funding. We were able to change the proportion that the federal government paid and the Virgin Islands paid, changing it from 55% paid by the federal government and 45 by the Virgin Islands government to over 80% paid by the federal government, as well as increasing the overall amount, which allowed us to bring 20,000 more Virgin Islanders onto the Medicaid roll. And that then increases the amount of paid people going to our hospital, which then increases the amount of revenues coming into our hospitals. But there's a lot of work still to be done.
Oh,
And we're going to need your continued support and the grassroots actions of your nearly 38 million members to make that change.
Yes, thank you. And we'll certainly support you as we work together to create a more livable community here in the Virgin Islands and across the United States, for that matter, with our more than almost 22,000 members here in the VI. That's almost a quarter of the population who are
Amazing.
AARP members. Yes. And so, on behalf of AARP in the Virgin Islands and our members here in this territory and across the country, I want to say thank you, Congresswoman Plaskett, for taking part in today's talk show discussion about the historic provisions for lowering drug prices for Medicare recipients in the Inflation Reduction Act of 2022. We've been talking with our special guest, Congresswoman Stacey Plaskett. And as we near the end of our show, would you like to share some comments, some final closing comments?
Of course. I, of course, want to thank you and your entire AARP team, Virgin Islands team, for the excellent work that you all do. Of course, I have to shout out my Aunt Corinne, who is one of your volunteers. You have a great number of volunteers that are working at AARP and boosting the kind of projection. You guys are always punching above your weight. Our territory's
Yes.
inclusion and provisions of the massive pieces of legislation that have been signed into law are things that we've been fighting for since I came to Congress and even before that. I and the team that I have have secured enormous funding for our home, and we're tremendously proud of our work. And I just want you to know that our team remains 150% engaged on the Hill, here at home, and especially with you. And so, to your listeners, if you have issues that you need us to resolve, please feel free to call us. The number on St. Croix is 340-778-5900, and on St. Thomas at 340-774-4408. Thanks, Troy.
Great. Again, Congresswoman Plaskett, thanks so much for being with us, and we look forward to having you on a future program, a future conversation with AARP in the Virgin Islands to share more of all the great you're doing on the Hill for us. Have a great day.